you for tuning in to Women's Health Issues. We are meeting today with Dr. Lyndon Taylor, board-certified gynecologist, practicing in Oak Park, Illinois. Today's topic is hysterectomy. Good morning, Dr. Taylor.
Good morning.
So, Dr. Taylor, what exactly is a hysterectomy?
Well, most people think that a hysterectomy means removal of the uterus, tubes, and ovaries. But actually, hyster means uterus, and ectomy means to remove, so hysterectomy just means removal of the uterus.
So, why would you do a hysterectomy?
Well, cancer is not the only reason for a hysterectomy. Other common reasons include chronic pelvic pain with abnormal bleeding caused by fibroids, endometriosis, pelvic inflammatory disease. Uterine prolapse is another reason for hysterectomy.
A friend of mine had a hysterectomy for fibroids, but they also took out both ovaries, even though they were normal, just because she was over 40. You know, she told me she felt like she had been castrated. Right away she went into menopause. Is it really necessary to remove normal ovaries when you do a hysterectomy for fibroids?
Well, no, it isn't. They used to do that for all women over 40 because of the 1 out of 100 risk of ovarian cancer. But today's woman does not want to go through a sudden surgical menopause at 40. And thanks to ultrasound, it's easier to monitor the ovaries after a hysterectomy.
She also had a really big abdominal scar that hurt for a long time after surgery. And she couldn't go back to work for 6 weeks. Is this always necessary?
Well, many times we don't even have to do a hysterectomy. We may try to repair the uterus without removing it. We do this with laparoscopy. Laparoscopy involves a tiny incision in your navel for a laparoscope, a hollow tube with a camera on the end which magnifies the image for the surgeon. Quarter-inch incisions are then made for the instruments that are used to perform the surgery. If a hysterectomy does have to be performed, we can do a laparoscopic assisted vaginal hysterectomy with preservation of both of your ovaries if they're normal. The uterus is then removed vaginally and the top of the vagina is closed.
So what are the complications of hysterectomy?
Well, the usual complications of hysterectomy are bleeding, infection, injury to bowel or bladder, deep venous thrombosis or clots in your legs, and anesthesia risk. Because of this, we take extra care to prevent these complications with laparoscopy. The patient will have a bowel prep prior to surgery to help protect the bowel. Cystoscopy will be performed after the surgery to evaluate the bladder and the ureters. Sequential compression devices and TED hose help us prevent clots in the patient's legs. And antibiotics are given 1 hour prior to surgery to prevent infection. This with meticulous surgical technique, aided by the camera magnification on the TV monitor, helps us to prevent bleeding and injury to other organs.
So are these complications common?
Well, with all these modern procedures and technology, complications have been drastically reduced. Also, it's important to have a surgeon with years of experience. I've been performing laparoscopic-assisted vaginal hysterectomy since 1991.
How quick is the recovery after this surgery?
Well, patients usually go home after a 23-hour observation and may return to work as early as 2 weeks.
And scarring?
Well, with laparoscopy, there's minimal visible scarring.
Wonderful. Well, thank you very much for joining us on Women's Health Issues, Dr. Taylor.
It's been my pleasure.
I look forward to seeing you again when we explore alternatives to hysterectomy. Dr. Lyndon Taylor can be reached at 708-848-9440 or on his website, www.chicagolavh.com. This has been Women's Health Issues. Thank you for watching.